This is Max Harris, MD. I was born in 1935 at Valley Baptist Hospital on F Street. I grew up in San Benito, Texas. I graduated from San Benito High School. I attended the University of Texas at Austin and received a bachelor's degree there in 1957. And I attended the University of Texas Medical Branch at Galveston, Texas for my medical school until graduation in 1960. I then spent another 4 years in Galveston in internal medicine residency and as chief resident and instructor in internal medicine. In 1965, I went on active duty in the United States Air Force as a captain in the Medical Corp. I was deputy hospital commander and chief of professional services at McConnell Air Force Base in Wichita, Kansas. On discharge from the Air Force in 1967, I went to Harlingen and went into practice with Dr. Charles Pascal for 20 years. I also became active on the medical staff at Valley Baptist Medical Center. The things I noticed about the medical center at that time was the pathology department was excellent with Dr. Flory. The clinical laboratory was very good, supervised by Mr. James Parrott. Bacteriology was well supervised by Dolores Parrott. The radiology department was excellent. It was begun by Dr. Robert Smith and Dr. Archie Martin. All during the time I was there, the radiology department continued to improve and add new resources at all times. It was active all the time. About the second year I was there, it was determined that the primary care physicians were not really able to cover the emergency room adequately, and so emergency room physicians were employed, and over the years they became very essential and became excellent. We got to know them well. They were excellent physicians. Many of them stayed there nearly their whole career. Following that, Dr. Michael Finnegan was recruited, and he was the first neurosurgeon in the Rio Grande Valley for many years. He established a neurosurgical unit and a neurointensive care unit. About that same time, Dr. Garner Klein and Dr. Marion Lawler established a coronary care unit, and they began doing open heart surgery and cardiac catheterizations. Dr. Tom Clark was also a cardiovascular surgeon involved with that development. That was very successful, and because of the patients that were following cardiac surgery, an intensive care unit was established, not only to take care of the cardiovascular surgery patients, but also other critical care patients. And the first critical care physician was Dr. Bill Torkelson, and the first pulmonologist was Dr. Leslie Peon. The intensive care unit was extremely active, and it continues to be a very essential part of Valley Baptist. Following that, a dialysis unit was established, and Dr. Doherty was the director of that for many, many years. Also established was a neonatology unit at the suggestion of Dr. Fish and Dr. Tolan, and a neonatologist was employed, and the neonatology unit has been extremely active and very successful over many years. The last one thing that has been established was a stroke unit. Dr. Victoria Parada was recruited to start that unit, and she did so, and it has been extremely successful. I've noticed all the times from 1967 that I was on the active staff until the year 2000, Valley Baptist has been very forward-thinking and has been very successful and has had a wonderful 100 years. I have also been on the honorary staff from 2000 until I moved to Austin in 2021. I wish it continued success for the next 100 years.